Alright, now I'm gonna bring back a memory that will make some of you cringe and possibly ache at the thought of. But who remembers falling off their bike as a kid? I'm not talking about the kind of fall where you kind of lose your balance and you like tip off your bike and get a few scrapes. I'm talking about the fall where you know just before you hit the ground that that's gonna hurt. Just from how fast you're going, you know it's not gonna end well. I'm talking about the kind of fall where your legs intertwine with the body of the bike and how now you have accompanying tiny pieces of gravel and pavement in your knees and elbows. I'm talking about the kind of fall where your knees are so beat up that you need help getting up. And when you do get up, you can feel the pain in every single step. I'm talking about the kind of fall that you remember just because how painful it is. This probably happens to you, or usually this does happen to you in your younger years when you're just figuring out how to ride a two-wheeled bicycle, and when you're just getting used to the high speeds or downhills. So usually when you get in these accidents, you go to your mom to, or whoever, to bandage you up. This will just be a closer look on how your mom or whoever bandages you up treats the wounds and prevents infections from basic first aid. Sometimes a simple Band-Aid will do the job just fine. Other times, depending on the severity of the wound, the area needs more than just a Band-Aid. In this case, we're going to talk about all the steps that go on to dressing a wound. In this case, a bicycle wound. So, first step is you, or whoever is taking care of you, needs to wash their hands, because bacteria is everywhere, and if you don't wash your hands, you don't want the bacteria on your hands to cause infection or further infection to the person you are taking care of, or if you are being taken care of, you don't want further infection from somebody who went to the bathroom and didn't wash their hands and now they've got their hands on you. That's just no fun, and it's not really fair. So after you wash your hands, you want to stop the bleeding of the patient or the person that you're helping by applying pressure for 30 to 45 seconds. If that doesn't work and they keep rebleeding or the wound keeps reopening, that might be a sign of internal bleeding, which usually happens. That doesn't usually occur on the appendages like your arms and your legs. That usually occurs in your torso area or your chest with more puncture wounds or severe accidents. But if that does happen, then you would have to seek professional medical attention for further examination. Next, you're going to clean the wound thoroughly. To do this, usually you just use plain soap and water. That's the best thing to use. Some people do use alcohol. That's a good, you don't have soap and water around. Alcohol is a good last resort. But the best thing to clean out your wound is definitely soap and water, because then you can really focus on cleaning and you can focus on getting that extra debris out. You definitely want to make sure, like, if you're on a driveway or something, like you fell on a driveway, you want to make sure the stones are out of your wound and that there's anything that's going to prevent the healing process or push it back, if that makes sense. Because when your body opens up or when you get injured, your body starts reacting automatically. So when you get pieces of stone stuck in your legs or your arms, your body tries pushing them out, and when they can't, they start forming skin over it, and you don't really want that either. So just make sure when you're cleaning that you get all of that out, and you're thoroughly cleaning your wound. After that, you put antibiotic cream or ointment on the area. This keeps the infection clean keeps the wound clean and keeps the infection out. And the wound healing process for this, that you want to keep the area moist. You want to keep the wound moist, but you don't want it like saturated, and you don't want it to dry out. So you want it like half and half. And then finally, when you dress the wound, you want to make sure it's covered with either a Band-Aid or gauze or medical tape, or gauze and medical tape. That's totally up to you. But definitely cover it up until it can heal on its own, or it is better healed. If you do get an infection, some of your symptoms could be a fever, a red ring around your wound, cough, congestion, chills, sweats, pain when you urinate, increase in urination, or diarrhea and vomiting. All of these can be signs of a staph infection. Staph infections are actually one of the more common infections and are easily acquired. They ooze, they pus, they're puffy, they're painful, but they can be medicated. This is one example of a staph infection. As you can see, there's kind of a red. It's puffy, it's got some bumps. Here's another one. That one shows more of the red ring. You don't want that, because that is also very sensitive and not fun. Also, I forgot to say, if you have a weak stomach, don't look at this last picture because it's kind of disgusting. But this one also shows, I like this picture because it kind of shows how it turned black. That's like the skin cells dying. So it's, and you can also see the pus in that one. And the red ring. So those are how the staph infection can look when it gets really bad. But, so if you don't want to get an infection like that, or decrease your risk of infection, I highly recommend following these easy steps next time you find yourself with an open wound.